Republican Minority Whip and Virginia Congressman Eric Cantor joins us now. So good news, bad news. They don't like Pelosi, but you guys are going to be outvoted in committee and outvoted on the floor, I suspect, with health care.
Well, Andrea, it's good to be with you. Listen, I think right now where we are is this attempt to try and pull the bill towards where the blue dogs are has now caused many more on the other side in terms of the philosophical spectrum, those on the far left, to now say they will oppose the bill. And really, I might even venture to say that there are probably more people against this plan in Congress now than there were yesterday, and which speaks to the matter of the public. You know, as you were mentioning the polls, Andrea, I think the polls reflect a lot of uncertainty about what this plan's really going to do for people's health care. And that's why we're here as Republicans saying, look, we've got a plan. We want to engage. We want to be a part of the solution here. But we cannot embrace this incredible grab here and trying to inject government more into the health care decision making.
Well, I'm told by Ken Strickland, our producer up there on the Hill, our crack producer, that you met today with the Republicans on the Senate Finance Committee. There aren't that many meetings across from House to Senate. So what are you and Senators Enzi and Grassley talking about? Are you trying to slow them down on the Senate side?
No, what we're trying to do, Andrea, is tell them where House Republicans are. House Republicans have a plan. We believe that you ought to be saving tax-free for health care. We believe that you ought to have flexibility in the insurance laws so you don't lose your coverage when you lose your job. We believe that small businesses and individuals should have the same benefit and discounts that the larger folks have in terms of purchasing health care. We believe there ought to be a robust market for individuals to purchase health care just as they purchase a lot of other type of insurance products.
To incorporate any of your House ideas into their Senate negotiations, since you're not getting much of a hearing on the House side?
Well, that's exactly why we wanted to meet with them, to tell them, look, House Republicans remain united around the principle that we reject the status quo. We understand there needs to be health care reform, but the route being undertaken by Speaker Pelosi and Henry Waxman right now is not where America needs to go. We don't need a government takeover of our health care system.
You heard me give some of the sort of negative responses from that focus group outside of Baltimore last night to Peter Hart about Nancy Pelosi, but there were some pretty negative ones about Sarah Palin, and John McCain didn't do that great either. People said over the Hill, disappointing, strong-willed. That, I guess, is more of a positive. Where do you look in the Republican Party for new leadership? Is it Sarah Palin?
Listen, Andrea, where our party is going is towards the pursuit of good ideas. What we'd like to see over the next month for sure is a robust discussion around the consequences of what we're trying to attempt to do here in Washington. And that is, are we going to be able to, number one, bring jobs back to this country? And number two, are we going to be able to accomplish health care reform in a way that doesn't harm our goal of providing more jobs? So, Andrea, I think that when you ask about where are we turning to leadership, our party is premised on how we can make the future better for this country.
Is it constructive, though, to have so many members of the Republican House caucus expressing doubts about the president's nationality and whether he's really a natural-born American, and raising questions about birth certificates? Isn't that a distraction that raises all of those questions all over again about how inclusive the Republican Party is?
Again, I don't see, maybe you're seeing something different than I am. I don't see so many House Republicans even saying any of that at all, Andrea. So I think that where people are concerned and our focus here in the House is on the matters of the day right now, which is what this health care means to their families. How do we get this economy going? How do we create an environment where there are more jobs for Americans?
Okay, we'll leave it there. Thank you very much, Congressman Cantor.